This week, the race to trace the coronavirus. The PopUp Groups trying to help us all to get through it. And breathe, helping children to use their inhalers. As the coronavirus has swept across the globe, the ability to know exactly where it is has become the crucial key to stopping it.
We have a simple message for all countries: test, test, test.
Some countries have really cracked how to do this. South Korea, with its drive-through 10-minute tests, is held up as a model for others to follow. But many countries are struggling to test at scale. In the UK, testing is having to be limited. The cost, the infrastructure, and the time the tests take are all holding back the battle against this disease. Now, there are dozens of efforts going on around the world to try and solve this, and Jen Copestake has been looking at one close to home in West London.
Around the world, companies and increasingly individuals are racing to find ways to accurately test people for the coronavirus. The situation is changing daily, if not hourly.
We simply don't have mass testing available for the population now, and there's a big effort going on to try to get that in place as quickly as possible to be able to manage this.
We're in negotiations today to buy a so-called antibody test, as simple as a pregnancy test, that can tell whether you have had the disease.
There are two types of tests being worked on: diagnostic tests, which identify people who currently have coronavirus, and antibody tests. These look for antibodies in the blood to see if a person ever had the virus in their system, and if they did, when. The diagnostic tests are primarily based on a technology called PCR, polymerase chain reaction. This is a standard molecular technique that identifies the genetic material of the virus from a throat or nose swab. Special emergency use authorization from the American Food and Drug Administration has enabled two companies to ramp up commercial testing efforts in the US. One is Swiss company Roche, which uses its Cobus machines, which are already in many hospitals across the country, to increase the amount of people who can be tested at once. The other is Thermo Fisher, which uses its Applied Biosystems PCR instruments. The company aims to produce 5 million tests for these machines by early April. But it's not just big companies getting involved in testing efforts. In West London, a community of open-source scientists, engineers, and microbiologists working out of shipping containers in the Open Cell Bio Village are trying to help. There are 70 shipping containers here, with labs looking at a range of biotech challenges, from personalized medicine and DNA sequencing to bioelectronics and biomaterials. Its shared molecular biology lab has been transformed to experiment with expanding testing capacity, while also designing a portable lab solution built out of a shipping container that could be easily transported.
We're trying to use these automated methods to speed up the testing kit, because in order to test for large populations, we need millions of Covid-19 testing kits.
US company Opentrons donated 2 of its liquid handling machines to the lab for their work. These plates can test up to 96 samples at a time. These are also PCR diagnostic tests, like the ones we saw with the other companies, but these are open source rather than proprietary, and OpenCell says they would like to get the cost of testing down to £5 to £10 per test.
Here in the UK, I think it's really about coming into that NHS pipeline, being able to augment someone's existing pathology department and being able to say, look, here's the molecular biology kit to high throughput this, so that you can, the same one person could do 96 tests when they're doing one anyway.
If it receives regulatory approval, a lab could theoretically be set up with just 3 machines inside a shipping container. As well as being able to augment existing pathology labs around the country, A shipping container setup could help people in places with far less access to medical facilities.
Besides that it's only useful for the UK, it definitely is also useful for other countries, and it is also something what can be also reused in case anything like that happens again. So there's also like a long-term value there, really.
There are some other innovative tests being developed in the UK. The University of Leicester is working on a face mask test using money from Research England and partnering with the NHS to repurpose the test they were using for tuberculosis. By wearing a face mask for 30 minutes, with 3D printed strips inside, it can show whether the person is breathing out the virus. Scientists at the University of Oxford say they have developed an ultra-sensitive test which can work in just 30 minutes. They say it doesn't need the kind of machines used in the other tests and could be deployed to rural or remote areas quickly. They also say its sensitivity means it can detect when someone is in the earlier stages of the virus, which could help slow down transmission. Detecting the virus in the early stages and in asymptomatic carriers could indeed be game-changing in halting its progress. Getting more tests out to as many people as possible, as soon as possible, could provide the data needed to accurately track the virus.
That was Jen, and it will be fascinating to see how that story develops pretty quickly, I would imagine. Now, with countries around the world battening down the hatches and locking down huge swathes of the population, everyone is having to make a plan for how they're going to live through this. Technology will play a massive part, and Stephen Beckett has been meeting the PopUp Groups who are trying to do their bit.
Following in the footsteps of China and other countries around the world, many people in the UK are now being asked to stay at home or self-isolate entirely, particularly if they're in an at-risk group. But that isolation poses its own challenges, from getting access to the basic necessities to looking after your mental health. Well, in the last week, pop-up online communities have appeared to try and help solve some of those problems. This is the Covid Mutual Aid Network. Each one of those pins is a local group pledging to help people in their community isolated by Covid-19. And believe it or not, just a few days ago, none of them existed at all. In less than a week, the movement has snowballed into an entire improvised volunteering infrastructure.
I'm so surprised at how much it has grown since then. Yeah, now I think there's like more than 7,000 or 8,000 local people involved, and every single ward in London seems to be covered by a WhatsApp group where folks are looking to volunteer or connect with other people who need help. So it's phenomenal.
At the moment, the real heart of all of this is something quite basic, really. It's groups on WhatsApp. And you can see these are just a few of the ones I've joined in the last few days, and already they've got hundreds and hundreds of messages from people offering their help and trying to get involved. Now obviously this is just around me, but I'm told similar groups are cropping up all across London and in some places around the UK. Beyond WhatsApp, groups are using open access tools like Google Docs, Sheets and Forms to bootstrap a whole volunteering infrastructure out of nowhere. And all of that organisation is essential if the groups are going to reach more people in the community who may not be looking for support online. It's about 9 AM and I'm in an estate in central London, just waiting for a few members of the local group. They're planning to flyer this entire estate, every single house this morning. And the idea is that if anyone needs some help, maybe some supplies brought to their door, or even just someone to talk to for a bit of support, then they know that they've got someone they can call.
Yeah, it's difficult, isn't it?
I think this is a really scary and anxious time, but I think the best way forward is everyone coming together. And what an amazing time to discover your neighbours. In this time we're going to be shut in our neighbourhoods. Should we start over? Yeah.
I think it's grown so quickly because actually everyone feels a little bit at a loss of what to do and how they can help right now. And I think everyone's kind of thinking, well, you know, we feel okay perhaps, but what about the others who are struggling?
Social media, though it has pros and cons, this is one massive pro. So we're actually now able to kind of unite online, and given social distancing, we've been able to kind of coordinate and plan remotely and get together. Also give each other support. It's really important that we don't feel isolated at the moment, although we are physically. So actually connecting via social media is bringing community together and really helping to combat loneliness.
the wider group are clear to point out that they are not medical professionals, nor is it an official charity. This is a volunteer community effort trying to do small things to help. But does that mean the goodwill could be exploited?
I think it's still a little bit tricky and dangerous at times because the wrong messages can be sent, and we're struggling with that a little bit as well, like some misinformation or fake news being passed around, which is just not helpful.
It's such early days for projects like this, so it's not clear yet just how much impact pop-up volunteering communities could have. But done safely, it feels to me like a good idea and some welcome good news.
Hello and welcome to the Week in Tech. It was the week Amazon stopped stocking all non-essential items from its warehouses following the demand for household necessities during the coronavirus pandemic. Apple was served a record-breaking €1.1 billion fine by the French Competition Authority for antitrust practices. The company was found to have an unfair agreement to control prices with 2 French wholesalers. And the US Department of Health and Human Services was hit with a cyber attack in an attempt by hackers to slow down its response to the coronavirus pandemic. How would you feel if your favourite social media account called you ugly? It was revealed this week by The Intercept that video sharing app TikTok instructed moderators to suppress posts created by users it deemed too ugly, poor, or disabled. TikTok has said that the initial goal was to prevent bullying and that guidelines have changed. If you ever thought gaming and reading were incompatible activities, think again. The Uncensored Library was created on Minecraft by design studio Blockworks and contains censored journals and articles which are banned in several countries as a way of avoiding press censorship. And finally, if you're concerned about who's preparing your lunch, there's a robot to help with that. This robo-chef in Tokyo, Japan, has been cooking up noodles for customers. However, the kitchen bot does need a little human help, combining the noodles with broth and veggies. Ramen to that.
Over 1 million children in the UK are suffering from asthma. A recent report suggests that 94% of all sufferers aren't using their inhalers correctly. But it seems there could be some technology that's coming to the rescue in the form of an augmented reality app. I've come to Crawford's Church of England Primary School in Suffolk, where they've been trialling the app on both pupils who do and don't suffer from asthma.
Let's press play.
The aim of My Spira is to create a fully immersive experience to learn about asthma and the triggers, and at the same time it gamifies improving inhaler technique. And it's centred around 2 inhalers here, both providing treatment, one of them preventative and the other one to be used in the case of an asthma attack.
Hello, I'm here to talk to you about asthma. Someone who has asthma will have symptoms like coughing and wheezing. What we need is a rescue inhaler, otherwise known as a reliever.
I was quite enjoying that, but more importantly, I'm joined here by a few of the first users of the app. We've got Freddie, Jasmine and John. This looks like a game of pairs. What are you learning from this element?
So each card will have something that could happen if you don't use your inhaler. So this one says coughing. I've learned how to use the inhaler and what the different inhalers are called and what can happen if you don't use the inhaler.
Well done! You found all the cards.
Issues with not using inhalers properly is that we see a much higher incidence of emergency admissions with acute asthma attacks and also chronic infection occurring and actually asthma deaths still happening.
How useful do you think this is to somebody who doesn't actually suffer from asthma?
Well, I think it can be very helpful in case, let's say, you're with a friend, a family member, and there's no one else there, and they have an asthma attack. You could find their inhaler and help them out with it.
And how about you, Jasmine? Because you do have asthma, I know. And how useful have you found it?
It really helps if you want to learn how you use your inhalers. If you don't use your inhaler properly, then your chest will go funny.
One of the issues is that children will inhale, if they use the inhaler directly to their mouth, they will inhale it too quickly. If the inhaler technique is poor, effectively, you might as well spray it up in the air and take a big breath in.
Fact! Asthma symptoms are often worse at night and also during exercise.
John, what do you think of the app?
Like Freddie said, it's great for people with or without asthma because you could get it at any point of your life. So even if you don't have it now, you could have it later.
The interactive part of the app is what's key here, and the gamification. We know that children learn through technology now. That's the way it is. During an appointment, we'd love to have more time to be able to spend with them, but actually what they can do with the app is take it home, learn an environment they're comfortable in, and also learn at their own pace.
I can't really question how immersive this is because all three of them look totally glued to the tablets. The knowledge gleaned from this AR game could prove life-saving.
I hope you've enjoyed the video. That's all I have to show you for now.
That was Lara with a reminder that there are other conditions which also need managing, lest we forget. So earlier we looked at how social media was allowing people to come together to try and help us all to get through the Covid-19 outbreak. We have a different tale now of how tech can, in small ways, help chip away at poverty and hunger. David Reed has been to Mumbai to see an app which is coordinating deliveries of free food to the city's poor.
Mumbai's Dabawallas mastered food delivery almost a century before mobile phones and apps were even invented. They've been studied by business schools and featured in movies. Now they're among the lead actors in another story, centering on an app to feed Mumbai's hungry. A fascinating enough tale on its own, but for the extraordinary life stories of the other people behind the app. I met up with Navin, who 8 years ago had an appalling car accident in Hong Kong.
I had a crash and I didn't even know I had a crash.
He lingered in a coma for months. When he finally woke up, his outlook on life had changed.
After spending 5 months in the hospital, I was given the chance to live again. And I had to ask myself the question, what is the difference I've made as a human?
Navin put his head to one of the biggest issues of our time, inequality. His aim was to somehow get those with too much to give to those with not enough.
A place like Mumbai has very visible disparities of wealth. What is less easy to see is how do you get that oversupply, that excess, into the hands of those who really need it.
Navin teamed up with someone else who had cheated death, cancer survivor and app developer Darshan. They put together an app that lets people pinpoint a need and find someone to meet it.
You find some person who is in need of some food. You go ahead and take a photo of that person or his location. Then you can target that location and broadcast that within the group, with the people who are in your vicinity.
The need can be food, clothes, shelter, anything. The tag also carries other details, local landmarks, how many live at the address, that kind of thing. Now, you can meet the need yourself or be like the Dabawallas and find someone on the app who's got something to give. Sri Ganesh restaurant cooked a little too much this lunchtime. They put it on the Gift a Deed app, so food that would otherwise go to waste is picked up by the Dabawallas. They scan the app for someone nearby who needs it and hit the road. Manisha has 6 mouths to feed. She says they usually eat just once a day, so she's super happy to have an extra meal today. Oh, and she says the kids loved it. Incidentally, the geotag for the need can only be removed by someone at that location. So once the need is met, the flag comes down. It's kind of like Pokemon Go. Giving is becoming a game.
The gamification starts from the time you start identifying a need. The app awards points to the users, and the dashboard also reflects which are the top taggers in the city.
So it's sort of like competitive philanthropy.
I wouldn't even call it competitive, but I would call it encouraging and rewarding people to see at any time the good they've done so that they can do more good, to be contagious, goodness to be contagious.
The app's only just off the ground, but there's already been thousands of meals delivered. The developers envisage tweaking the app to track disaster relief and aid deliveries. If so, through their brushes with death, Darshan and Navin could end up improving, even saving the lives of many others.
That was David Reed in Mumbai. Right, who's up for a big dollop of escapism? Yeah? Uh-huh. I thought so. Well, the movie Avengers Endgame is pretty hard to beat in that respect. And we've been behind the scenes with visual effects supervisor Matt Aitken to see how they brought the film's climactic battle to life. Warning, this will contain spoilers, but if you haven't seen it yet, well, I'd imagine you'll be streaming it in the next few weeks, actually.
Thanos did exactly what he said he was going to do. He wiped out 50% of all living creatures.
Our work on the end battle was kind of encompassed all the different aspects of modern digital visual effects work. We had lead digital characters, we had giant battle scenes with entirely digital armies, the battles taking place in an environment that's almost entirely digital. Lots of complex simulation work with destruction events and fire and complex all the superpowers often involve simulation work. Digital doubles of like 47 lead Marvel characters for those wide battle shots. So a fantastic space to be working in. I think the way that they really make it work is that they keep these vast battles, they keep them personal. So even though you've got these huge, wide, epic shots of the armies clashing, those are actually quite few and far between. We don't spend a lot of time in that sort of space, and we quickly drill into the individual complex battles, all the emotional lines that are playing out with all these multitude of heroes that are coming together on this battlefield. Chunks of it could be blocked out quite early on, but there were pieces of the puzzle that were about tying it all up. The sequence was entirely filmed within the studio. They're being filmed on a green screen stage, but depending on how it plays out, we may or may not keep the set part of the environment, and sometimes what we'll do is we'll end up just keeping the actor's face. We actually welcome the opportunity to replace the environment in that way because it liberates us to take control of the lighting of the scene in many ways. We like to get things through the render farm overnight, but some of those big battle shots, with thousands of digital extras, complex simulation work going on, there's weeks of rendering if you look at it, breaking it down, just in some of the shots. But we do have a big render farm, so we got it all through. There was a huge amount of pressure that this was the culmination of 22 films, and not to muck it up was what everybody felt. So there was a huge amount of focus on doing justice to this whole huge arc of storytelling.
This is the fight of our lives.
This is gonna work, Steve.
I know it is. Because I don't know what I'm gonna do if it doesn't.
Well, I don't know about you, but I really needed that. Oh. But that's it for this week. Don't forget, though, that you can always find us on social media, more than ever these days, for obvious reasons. And why not get in touch? Let us know what you're doing to get yourself through the current situation. Never know, we might even put some of your suggestions on the air. And if you are stuck for something to do while you're working at home, why not check out our massive back catalogue? It's on iPlayer in the UK and on YouTube everywhere. And we're on Facebook, Instagram and Twitter too, at BBC Click. Thanks for watching, be safe, and we'll see you soon.